It's 5 o'clock and time for Wiregrass Strong. The new coronavirus epidemic is a big problem that's expected to become bigger in the weeks and months to come. For those who are infected as well as those trying to avoid infection, these are trying times. But amid all the doom and gloom, there are some positive stories, positive messages, and reasons to remain hopeful. So every afternoon at this time, your Wiregrass Radio family of stations will come together while staying apart to help you stay informed. We're going to be seeking your input. If you're a business impacted by the virus, call and let the Wiregrass know what you are doing to continue safely providing your services or goods. And if you're a parent working hard to take care of your family, we'd love to hear how you are coping. Remember, only the facts, no hearsay or rumors, and we're trying to keep things positive. Our number is 334-699-1053, or you can join us on YouTube Live, and you can chat throughout the program. And welcome to Wiregrass Strong, wrapping up week 8 of Wiregrass Strong on all of our stations, WECB Headland Dothan, WJRL Slocum Dothan, WESP Dothan, and WBBK Blakely Dothan. And this half hour is brought to you as a public service of Knight's Wrecker Service. Big or small, they do it all. 899-3257, Ashford, Dothan, and Headland. Fine folks, great equipment. You need them, you call them. They'll be your knight in shining armor. One more time, that number, 899-3257. We are streaming live on Facebook right now at B1053, and we are on YouTube at Wiregrass Radio. That is our channel. And we'd also like to thank our media partners, News 4 WRGX. And before we go any further, I'd like to remind you, or actually billboard what's happening next week. Corey Kirkland, the public health administrator with the Alabama Department of Health, will be here with us. Also, we're going to have the Houston County probate judge, that is Patrick Davenport. He'll be here with us. And we'll also have round 2 of our retail roundtable. We had a lot of fun with that last week, and we'll do that again as well next week. A lot of great guests, a lot of great programs as Wiregrass Strong continues. And we want to thank you for being with us each day. Today on the panel, we have Marcus Cage, Magic 93.1. You can catch him 9 o'clock on weekday mornings on the People's Station, Magic 93.1. Hello, Marcus.
Good afternoon, everyone.
And also from B1053, Pollard and Dave. This is Dave Gilligan. Wash your dang hands, Gilligan. And good afternoon, Dave.
Good afternoon. Good to be here.
And a gentleman that we have tried to have on a couple of times, and we ran into some difficulty in making it happen. And I'm so proud that we've been able to get this gentleman on. He is a member of the Dothan Anesthesiology Associates, and he works out of Flowers Hospital. Like to say good afternoon to Dr. Lee Hughes. Good afternoon, Doctor.
Good afternoon. Happy to be here.
Great to have you here. And we are in, I don't know, we're somewhere around day 60 of a nation in lockdown. And folks are getting antsy, and some places are bucking the system and going back at it. And a lot of states are trying to keep the lid on it, as they say. But I cannot think of a more tense place to be is in our medical facilities right now. And Doc, our hats off to you and our healthcare workers who have to go in every day and do your job, which is right there at ground zero in most cases. Could you tell us a little bit about what you do over at Flowers Hospital in your role there?
Well, I'm the medical director for anesthesia at Flowers Hospital, and that, for the most part, that entails taking care of surgical patients and helping direct our efforts to help support the the care of patients in the hospital that are not surgical patients, maybe in ICU cases. We provide airway management and supportive services to the other physicians and other caregivers in the hospital as well.
I noticed behind you there, you had pulled up some of the numbers from today. Is that something you wanted to look at while you had us here with us?
Yeah, I was just looking at this. I found I was looking at Alabama numbers in particular. You know, I've been following those all along. And I remember last week I was looking at the numbers, and we had about 9,000 positive cases in Alabama. This was last Friday, I think I was looking at it. And now we have 11,000 positive cases. So that's that's a 2,000 case increase over the course of the last week. That's not surprising though. We've been doing a lot more testing. We've been most hospitals are screening almost every patient that comes in for any kind of surgery. So I'm not surprised to see more cases at this point. The one thing that stood out to me though is that we saw about 100 more deaths in the state of Alabama over the last week, which is, there's only been 473 deaths. I think was the official number, 476 now. And over 100 of those have happened in the last week. That's, 20% just in the last week of the total number. So, that's kind of worrisome as we go forward with lifting the things we've been doing to try to mitigate the spread of the disease. That's a little bit concerning to me, but it's hopefully not going to increase in the trend. So far nationwide, our trend is at least stabilized and maybe even maybe headed down just a little bit on a daily basis, but it's still over 1,000 people dying a day. And that's a number that's always concerning to us.
That is concerning in that we are week 6 or 7, depending on how you look at it. And we've had a 20% increase in 1 week over the total numbers over that time
nationwide, we were at a little over 80,000, weren't we?
That's correct. About 84,000 total.
84,000. So, Doc, that leads me to a very important question, and it's a term that we haven't heard a lot of in the past couple of weeks, and that is flattening the curve. Were we successful? Do we need to still be in that frame of mind even as we try to ease our economy back into some kind of normalcy?
I think the efforts that we made clearly changed the trajectory that we were on. If you look back to the cases starting in early March, we were on a steady increase. We were going straight up, and that's when we started all the mitigation efforts. And certainly the number of cases and the number of deaths flattened out after that. The thing is, it gave us a chance to get some things in place that might keep it from going back up. It gave us a chance to make some plans, but people have to utilize the things that they can do to try to prevent the spread. We can't keep the economy shut down forever. That's obvious, but we have to learn how to live with this thing and try to keep from spreading it, try to keep from giving it, and try to keep from getting it. That's my goal.
So essentially you're talking about almost really a mask culture moving forward, where people are going to be consciously putting barriers between them and others, whether they're infected or not. Is that what you're saying?
It really is. I think that right now our best bet is to try to get things moving again in the economy and to utilize masks as a barrier to keep from spreading the disease to other people. The last thing I read was you really need about 80% of the people in a given population to be utilizing masks to try to prevent the spread. And, right now, at least in our area, you're not seeing that in public. And I hope that we do in the coming days and weeks for sure.
I have a follow-up question dealing with the masks, Doctor. What are some of the things that you're seeing that people are doing incorrectly when using masks?
Well, in public, obviously, the places I've been to where I'm sure, a lot of people have been, you see some people wearing masks. The number one thing I'm seeing that's not being done correctly is people putting the mask on in the first place. But then the other thing is that you see people wearing a mask and they'll have it under their nose, or they'll have it under their chin, or certainly not covering their mouth and their nose. Now, the main reason for wearing like this type of mask, just a surgical mask or a cloth mask, is not necessarily to prevent you from getting COVID, but it's to prevent you from spreading or transmitting COVID. And it's not just, but the reason it's so critical that everybody gets involved in that equation is so we don't spread it to each other. So that's the whole goal of trying to get 80% of people in a public place to use a mask like that.
Right.
And how often would you say a mask needs to be changed, whether it's a manufactured mask or a mask like you're wearing as of now?
Well, these are really intended for daily use at best, if not patient to patient use. Now that's probably a little bit conservative. We're using our N95 mask for, several days at a time before we dispose of them. So I think as long as it's not soiled and not obviously dirty or contaminated, I think it's fine to use a mask for several days. I think the cloth masks that a lot of people are using in public are great. They just need to be laundered all along and maybe have 2 or 3 of them and just change them out.
It's still true then, Doctor, that soap and water is really the best way to kill the virus, at least if it's on the surface of something.
I think that all of your household cleaners are effective in taking care of it on any surfaces. Surfaces are a big thing, though, and they do need to be cleaned, because that's how I think that kind of transmission happens more than people would normally think, is just by touching a doorknob or touching something that somebody else has touched is a good way to transmit it.
So
Doc,
moving forward, Doc, I hate to interrupt you, Ricky, but moving forward, as we're trying to ease our public back into retail and restaurants, are we to be of the frame of mind where we got to carry hand sanitizer with us, in our pockets, in our purses, or perhaps as soon as we get to the restaurant, we wash our hands. We go to the bathroom and we wash our hands, and I'm just trying to get your opinion on how people should, when they're diving back in to this United States that's left after this pandemic has rolled through, what do we have to carry with us so that we are the safest we can be?
Well, I mean, I, for instance, I keep wipes in my car, sanitizing wipes in my car. So when I come out of a store, I come out of Lowe's or wherever I'm at a bin, that's the first thing I do is make sure I wipe off anything I took in. I wipe off my phone, my hands, and my doorknob. And I think that, having at least that in your car is a good thing. And I think if you can carry a little hand sanitizer with you, that's great. I think you just always have to be cognizant of the fact that anything you touch could be contaminated. And so you just need to kind of approach everything like that, and then you'll make the right decisions to take care of yourself.
Doc, are you finding that the medical institutions we have in our area have been well supplied with PPEs, or are you still somewhat lacking?
I think that, early on there was a lot of concern about the lack of PPE. I think right now we're adequately supplied. We're not supplied the way we were before all this happened. It's not that the hospital is not doing a great job trying to get the stuff, but it's just hard to get. Like I said, we're using masks now that we might use for 3 days now that were normally a single patient use situation. So it's certainly not the same as it was before, but I do think that it's adequate. And I think they've done a great job trying to keep us supplied with what we need.
Dothan is fortunate with our 2 hospitals and the way they're operated, and the staff, of course, top notch. And anyway, I'll put it up against any hospital system in the country. I've birthed a baby in that hospital. So
I agree. I think both hospital systems are doing a great job right now.
And they're doing the additional job as well. So many more safeguards in place now. I mean, already hospitals were somewhat, I wouldn't say sterile, but extremely clean. They always were. Now that program has been taken to another level, and all of the additional restrictions they have, such as, patient visitors. And one thing I wanted to ask you about was, are you seeing that? I'm sorry, I was distracted here.
It's okay.
Are you seeing that the elective surgeries have started back now? I know that was a big issue, is elective surgeries, and we just can't. It's almost like the economy. You can't shut that down. In fact, right. that is the economy of our medical institutions, is surgeries and practicing. And I hope that is coming back for our area hospitals.
Well, it certainly is important. And, like you say, the medical community here is a large employer. It's important to a lot of people. And we did absolutely stop elective surgeries for a period of time. There was two reasons there. Again, it was trying to get everything in place to prepare for an increase in COVID patients, but it was also in an effort to preserve our protective equipment, our masks and our gowns and all that sort of thing. And so just up until the last week or so, we were pretty much doing only emergent and urgent cases. Now we've started doing elective cases, outpatient elective cases, and we're going to move on into elective inpatient cases too, which will include our total joints and things like that, where people have to stay in the hospital for a day or two after surgery. But we are getting back up and rolling again now.
It sounds like you're very confident in the way things are moving, at least as far as the hospital and the medical field is going, and that fills me with confidence. That means that my life can kind of get back to normal.
I mean, I think so. I think we're definitely trying to shift back into more of a normal state of affairs for sure. It's been really hard for families with patients in the hospital, and they haven't been able to come in and visit. And those things have been difficult, but we're screening everybody that comes in the hospital, making sure they don't have temperatures and making sure that they don't have symptoms. And we're still making the effort to control, the influx of any COVID patients into the hospital. And we're testing pretty much everybody that comes in for surgery or any even testing in the hospital. So
give them the old twist and shout.
Yeah, that's right. I haven't had it myself, but I don't want to do it.
Yeah, it doesn't look like fun. And now apparently the testing that has started in the state, Dr. Hughes, that's going to be by appointment only, or if you're showing symptoms. Isn't that correct?
Up until recently, we were only testing because of just the limitation in the ability to test more. We were only testing patients that were symptomatic, and not even just symptomatic. You had to be pretty much sick enough to be in the hospital to get tested. Now, obviously, we've moved past that now. It's almost a test on demand with primary care doctors, a lot of the primary care doctors. But it's still the main criteria is that you're symptomatic in some way, respiratory or fever, cough, onset of symptoms like that. And,
so people aren't going to be able to just drive up and get a test. I guess that's my question.
I think that they will be able to in the coming weeks. And I think there's some places right now that people are able to do that. I know there's places you can get the antibody test. I don't know how reliable those are right now. But the actual COVID test, there are some primary care clinics that have a very low threshold for testing. They must have, as long as they have good supplies, then they're willing to use them to get folks tested. And that's all going to be good information. All those test results go to the Alabama Department of Public Health, so we can all find out what the penetration of the virus is in our area.
I just want to remind you today we are talking with Dr. Lee Hughes, an anesthesiologist over at Flowers Hospital. And we are happy to have him here with us today. Next week, we're going to have, speaking of the public health department, we're going to have Corey Kirkland in here with us. He is a public health administrator over there, and Houston County Probate Judge Patrick Davenport, as they open up some of the county facilities for tags and things of that nature through the probate office. And round two of our retail roundtable. While I have the ear of all four of our radio stations, I'm going to take a moment here to mention this. For our seniors, we are celebrating the class of 2020, and we need your help. We've set up a phone line at 334-245-3290, 334-245-3290. And if you didn't get that number, it'll be available on our Facebook pages for all of our radio stations, B1053, Magic 93.1, Rock 100.5, and 102.5 The Q. Again, that number, 334-245-3290. It's a place where you can leave a message for your graduating senior, and we will play those back on the air between the 5th and 7th, 3 whole days of nothing but blessings for our graduating class of 2020. And it's made possible by Sweet and Sassy, Uptown Cheapskate, the Daughtry Group, Gilt Boutique, Fairview Tree Service, and PC's Nursery. Getting back to Dr. Lee Hughes with us today. Doc, are you still, for instance, over at your place of business, do they still have COVID and non-COVID zones over there? Are they still set up that way, or were they ever set up over at Flowers that way?
They were, and we still are. We have an intensive care unit that's set aside for COVID patients, and we have a floor for patients that aren't in critical condition. A whole floor set aside for taking care of COVID patients as well. Hopefully to try to keep minimize the possibility of spread to other patients in the hospital and staff for that matter.
Doctor, I have a question about, you were talking about the numbers earlier, and I have a question about exposure. We've seen increase in the numbers, as you said, from last week to this. And I'm like you, I think that's due to now that we have more testing. Now we're just finding out people that are sick. But how about exposure? We are a fairly rural community. Have we been as exposed to COVID-19 as other parts of the country?
I don't think so. I think that we've been very fortunate. Probably, it may have a lot to do. It could just be luck at this point, but it may have a lot to do with the fact that we are a rural community, a relatively rural community, and that we instituted the social distancing policies early on. Mm-hmm. So we didn't have a lot of cases in this area, to begin with. It's not like people were already getting sick and then we instituted our mitigation policies. Mm-hmm. So, I mean, we've only in Houston County, I think we've only had 100, maybe a little over 100 cases positive. So we haven't had, but you don't have to go very far into Georgia before you start seeing communities that had big outbreaks. Sure. And those communities aren't that much different than we are. They just, were different in, they had a group of people that got together at the wrong time and they had an outbreak there. So, it may just be a matter of timing, or it may be a matter of just the policies that were in place at the right time.
Another question.
A little bit of all of it. Yeah.
Another question dealing with the numbers. I'm not sure if you can answer this, doctor, but there's a lot of rumors that are flying around, and there's basically too many to mention. But one of the things that I've seen is a lot of people are wondering, why are the numbers in the hospital a lot higher than what's reported to the county? In other words, Flowers and the medical center will have certain numbers that, when added up, is a lot higher than what's being reported to the county. Why is that?
That's right. The main reason for that is that as when cases are reported to the Department of Health, they're reported for the county from which the patient came. And so our hospitals are treating a lot of patients that are from Barber County or from Georgia or from North Florida. And those cases get reported in their respective counties to their respective, or states and counties to their respective departments of health. So they don't show up as a Houston County case if they came from Georgia. That's the main explanation for that.
You're just counting bodies, not where they came from.
That's right. That's right.
It breaks down to.
Well, yeah. When you like even the numbers that I gave you a little while ago, those don't include the patients that we've taken care of from Georgia, or from somewhere besides Alabama,
or whatever county you happen to be.
Right.
I get it.
Right.
Doc, let me ask you a personal question, if you don't mind.
Go ahead.
This pandemic hit us. It hit us hard. It hit us by surprise-ish. Overall, has Alabama, and specifically the Wiregrass, have we behaved well? Have we done what we needed to do? And do you see us continuing that behavior?
Oh, I think that we did exactly what needed to be done when we put in place the mitigation policies, and people abided by those really without too much in the way of defiance or having too much in the way of trouble with it. I understand people needed to get back to work. They needed to get their business going, and they weren't happy necessarily with some of the decisions that were made, but folks generally were very cooperative with the policies put in place. I think that we could do better. Just from my observations, I think we could do better in wearing masks and doing things like that can get us ready for what might happen down the road. I mean, we got a long way to the end of 2020. This is not over just because they've started lifting these mitigation policies. It's not over by a long shot. I mean, even if we see a decline in cases right now, there's nobody that doesn't think, unless we have some really effective available treatments, there's nobody that's not thinking that this could get a lot worse in the fall.
Mm-hmm.
In your opinion, doctor, do you believe that these lifting of restrictions is coming at a reasonable amount of time, or it's too early or too late?
I think I actually do think it's reasonable. I think the timing is reasonable because it's given us enough time to understand what we need to do going forward. We can't stay in lockdown forever, and nothing really has changed. You know, we don't have really good effective treatments right now. We don't have a vaccine, and those things are not in the immediate future, and we can't stay completely shut down forever. We just need to learn how to live with this thing and live with it safely. And so I think that it's time to start getting things going again, but I think that we really need the cooperation of everybody in the community to try to keep it from becoming a really big problem.
Right. And one last question that I want to know personally. Once a person does test positive and has the COVID-19, can they get it again?
That's a good question. You know, that's yet to be answered. There were some reports of people being infected secondarily. And then there were pretty much the conclusions that those people maybe never cleared the virus in the first place. Right now, the generally accepted idea is that you definitely have some degree of immunity after you have it. We don't know how long that lasts, and we don't know how strong that immunity is, but at least for, some period of time, you will have immunity. That's the general understanding at this point. That's why they're looking into using what they call convalescent plasma as a treatment, because people that have had it and recovered have antibodies to it, and they can take plasma from those people and treat people that are sick and potentially help them.
Well, Doc, there's a mindset out there right now that's gaining some footing, and that is, well, you ask us to flatten the curve, and we did, and now instead of that being enough, we now are asked to wait until there is a cure, and I believe that's the mindset some in society take, and that can get us in a lot of trouble. I think the common sense approach is obviously that, yes, we could flatten the curve, but the numbers you mentioned earlier, from 400 to 500 in the course of a week, which meant a 20% increase in deaths. I mean, was it cases or deaths?
That was deaths from, let's see here, from 371 to 476 is the last number I saw over the course of 1 week.
Yeah, that can be frightening, and that can be a direct correlation with the fact that, we're letting our guard down. We can't let our guard down. We got to wear those masks. We got to socially distance. We got to do it smartly. I'm like you. We can get the economy going again, but
we just got to do things differently. That's all.
That's right.
Here's the thing, and this has been my reflection this whole time. With change comes growth. And right now, we're, as a society, as a country, as a state, as a community, we're going through some tremendous changes. And what we have to do is turn that into some kind of fertilizer to grow and become better and learn how to operate with this thing. It's been 100 years since the last great pandemic, and the best we have is a flu shot that we have to get twice a year.
Right.
We've done it before, I guess is what I'm trying to say. We've adapted. We've learned how to deal with this, but we did it together, and we did it with kindness, and we did it with patience, and that's what I'm getting out of this. That's what I have spent my time doing during quarantination, as Amy calls it.
Quarantination.
I like that. That's a new thing. Can I use that?
Yeah. Well, look, we've had a great day today on Wiregrass Strong, and we want to thank our panel guest, David Gilligan from Pollard and Dave Mornings on B1053, and Marcus Cage from Magic 93.1. Catch him weekday mornings beginning at 9 o'clock right there on 93.1, the People Station. And we also want to thank our special guest this afternoon. And give us your official title again, Doc.
I'm the medical director of Department of Anesthesia at Flowers Hospital.
There you go. And that is
Lord of all, he surveys. I think that's what that translates to.
That's right.
Dr. Lee Hughes, an Ole Miss rebel. Oh, my goodness.
I'm sorry.
Sorry, go SEC.
We won't hold that against you. But by the way, let's go ahead and ask this question. Are you from this area, or were you from Mississippi or somewhere else?
When I was a kid, I grew up in Panama City, and my dad worked for a national paper company. We wound up moving around. My mom's folks were from Dothan. My dad was from Troy. The plan all along was that my dad, when he retired, he was moving back to Panama City. So that kind of helped me make decisions to come this way. Now he's still over in Natchez, Mississippi, on the river and loving life over there.
Me and you and Dave Gilligan need to get together, because me and Dave have breathed a lot of the fumes from the old paper mill in Panama City. We were both kids there as well. So,
how about that? That's great.
Anyway, thank you so much, Doc. Dr. Lee Hughes with us this afternoon. Folks, I want to thank and let me juggle this screen around here. All right. We have had a great week, and we'll do it again next week. As I said, our guest will be Corey Kirkland, Public Health Administrator at Alabama Department of Public Health, also Houston County Probate Judge Patrick Davenport. And round 2 of our retail roundtable will gather some of the retail folks who have been opening their doors back up to 50% occupancy. And we'll also do the restaurant roundtable again, too. We had a great time with that the other day. So we want to remind you this half hour is brought to you as a public service of Knight's Wrecker Service. Big or small, they do it all. 899-3257. And one more time, that phone number, so that you can help celebrate the class of 2020 by leaving a personal message for your graduate that you'll hear on the air on all 4 of our radio stations, is 334-245-3290. 334-245-3290. I hope you folks have a great week and stay strong, Wiregrass. And until next week, we're now going to return you to normal programming.